Welcome to The Explainer. Today, we're going to unravel a decades-long medical detective story about our eye health. We'll be pulling together just massive amounts of data to give you a really clear, structured look into how our vision changes over time. We're talking about the leading cause of visual impairment in the US right now, and we're going to dig right into the hard evidence to understand exactly how this whole thing works.
But hey, before we get completely lost in the biology, I want you to consider kind of a provocative question. What happens when a standard surgery, one that's specifically meant to restore your sight, actually reveals a hidden, compounding risk for an entirely different kind of blindness? It's a massive twist, one that completely changed how researchers look at eye health, and we're going to solve this visual mystery together.
Okay, let's dive into this roadmap. First up, the threat to our vision. Second, decades of eye research. Third, spotting the warning signs. Fourth, age, genetics, and lifestyle. And finally, the cataract surgery connection. All right, Chapter 1, the threat to our vision, demystifying age-related macular degeneration. So to really ground ourselves in the medical facts before we look at the data, we've got to define the stages of AMD. The condition is split up into early and late stages. Early AMD is marked by the presence of drusen, which are basically these little deposits in the eye, and some pigmentary abnormalities. Late AMD, on the other hand, is the severe stage. That features either geographic atrophy, which is this gradual breakdown of cells, or neovascular detachment, where abnormal blood vessels actually grow and leak fluid. And unfortunately, late AMD is what ultimately steals a person's central vision. You know what's really fascinating about the history of this disease? It's the terminology itself. Early on, the first clinical trials actually called this condition senile macular degeneration. But researchers pretty quickly realized that senile was an objectionable, not to mention inaccurate modifier. So the language shifted to age-related macular degeneration. And this wasn't just some clever PR move, right? It was a really crucial shift to accurately reflect the massive public health reality of the disease, especially as human life expectancy just kept increasing. That brings us right to our second section, decades of eye research, featuring the Beaver Dam and Blue Mountain studies. Now, to truly understand a disease linked to aging, you can't just look at a patient once, right? You literally have to track them for a significant chunk of their life. And building a timeline on this scale requires unparalleled medical dedication. The landmark Beaver Dam Eye Study in Wisconsin kicked off its baseline exams way back in 1987, followed closely by the Blue Mountains Eye Study in Australia in 1992. These researchers committed to checking these exact same massive cohorts of patients at 5-year, 10-year, 15-year, and even 20-year intervals. I mean, it's a monumental logistical achievement that finally allowed us to accurately measure AMD progression over decades. And wow, the resulting data absolutely changed the medical landscape. Published as peer-reviewed findings by the American Academy of Ophthalmology, the Beaver Dam Eye Study alone generated over 360 publications. The thousands of data points pulled from both Wisconsin and Australia essentially serve as the absolute foundation of modern ophthalmic epidemiology. We're talking about the gold standard of eye research here. So now that we know the source of the data, let's move to Chapter 3, spotting the warning signs, or the clues hidden right there in the macula. During these incredible long-term examinations, doctors learned exactly what biological clues to look for, and they're highly specific. Remember those little eye deposits called drusen? Well, the research showed that small drusen, sometimes called druplets, are actually incredibly common and aren't necessarily a severe threat. In fact, almost 94% of the Beaver Dam cohort had them. No, the real red flags for AMD progression are large, soft, kind of indistinct drusen, especially when combined with changes in the retinal pigment. When doctors see those large drusen and pigment changes together, they know for sure the patient is entering the danger zone. Now, what's really interesting about this next part is how researchers actually turned those physical clues into a predictive scoring system called the ARDS Simplified Severity Scale. It ranges from step 0, where there are no major drusen or pigment changes, all the way up to step 4, where a patient has large drusen and pigment changes in both eyes, and the data here is just striking. If a patient is at step 0, their risk of progressing to late AMD in 5 years is a mere 0.3%, but if they're at step 4, that 5-year progression rate rockets up to 50%. This scale basically gives doctors a crystal ball to predict a patient's visual future. Which perfectly sets up Section 4, age, genetics, and lifestyle, the factors we can and absolutely can't control. If we know how the disease progresses, we have to ask,
Who is most at risk, and what agency do they actually have over their own vision? Well, we can split the risk factors pretty cleanly into two categories. First up, the non-modifiable risks, the things you simply can't change. The data clearly shows that older age, being female, and possessing specific genetic risk alleles in the CFH and ARMS2 genes all drastically increase your chances of developing AMD. But then we have the modifiable choices. Current smoking is strongly associated with late AMD incidence, but on the flip side, regular fish consumption, we're talking eating fish at least once a week, was actually inversely associated with late AMD. So quitting smoking and tweaking your diet, those are active, real choices you can make to protect your macula.
And this data brilliantly illustrates just how heavy the burden at age truly is. Looking at the 15-year late AMD incidence from the Blue Mountains Eye Study, for patients in their 60s, the incidence sits at 6.8%. But watch how dramatically that leaps upward as patients enter their 70s. It jumps to 20.2%. And for those over 80, it hits a staggering 27.3%. Age really is the ultimate unavoidable catalyst for this disease. Which leads us right into the final chapter of our explainer, the cataract surgery connection, and honestly, the biggest twist in the whole investigation. See, because both cataracts and AMD are diseases of aging, they happen in the exact same patients all the time. So consider this paradox for a second. Does fixing one eye problem actually increase the risk of another? Think about it. If an elderly patient has a cloudy lens from a cataract and deteriorating cells from AMD, what happens when you surgically remove the cataract to help them see? Well, the crucial point comes down to this single number, 1.93. The 20-year follow-up data from the Beaver Eye Study revealed an odds ratio of 1.93. That means that having cataract surgery nearly doubles the odds of a patient developing incident late AMD. Just think about that for a second. The very surgery that's meant to restore a person's vision is acting as a massive risk factor for an entirely different blinding disease. It's wild. Now, this analysis was supported by the National Institutes of Health. And I want to reassure you really quickly, this is not a reason to panic, okay? It's just a reason to be informed. This twist was rigorously reviewed. Researchers ran the models to control for age, for sex, and even for those high-risk CFH and ARMS2 genetic alleles we talked about earlier. And even after stripping all those other factors away, cataract surgery remained a statistically significant, independent risk factor for late AMD. And get this, the risk isn't just immediate. The data actually shows that the time since surgery matters. Surgery performed 5 or more years prior showed higher odds for late AMD compared to surgery performed more recently. The risk literally compounds over time. So the main medical takeaway from the researchers is profound. If a patient is already at a high risk for AMD, doctors should strongly consider delaying cataract surgery for as long as it's compatible with, acceptable vision. All right, let's bring all these clues together for our explainer takeaways. We've learned that age-related macular degeneration is exactly that. It's tied strictly to advancing age, and it's marked by the progression of large drusen and pigment changes. We've seen that while genetics definitely play a huge role, your lifestyle choices like smoking and diet absolutely matter. And finally, we uncovered that shocking piece of data. Cataract surgery poses a significant independent risk for the incidence of late AMD. But hey, knowledge is only powerful if you actually use it. So I want to leave you with this final thought. How will you incorporate this knowledge into your next eye exam conversation? The data is totally clear. The warning signs are mapped out, and now the agency is entirely in your hands. Thank you so much for joining me on this deep dive into the research, and keep seeking the structure behind the science.